73 cents. This is the price per page of your medical record in the state of Maryland. Regina Holliday purchased her husband's medical records at this rate, all 3 inches worth. It is also the title of her 20 by 50-foot mural she painted in dedication to him. In a ceremony on October 20th, she revealed the mural to friends and family.
You go to the hospital and you get the record, you pay for that.
Pay for your record?
Yep. So it's sort of like if your teacher at school said, here's your report card, now give me $1.
Oh. Why would anyone want that?
No one would want that, right? There was no access to the record. We never see anything in writing. I asked to see things. One doctor took me over to a computer screen for a few minutes and let me read a couple paragraphs. That was the extent of access to his medical record. And they told me it would be 73 cents a page and a 21-day wait. I would need to sign this form. I'd have to have medical power of attorney showing that I had the right to see this. And if there was any duplication of the record due to their Xeroxing error, I would be responsible for it. So I said, you mean this could be hundreds of dollars? They're like, yes. You have to agree to it up front without knowing how much it's going to be.
After an untreated broken hip, a potential drug poisoning, and an almost ruptured bladder, the doctors decided there was nothing they could do but discharge Fred.
We weren't part of the decision to go home, and to give up, basically, because that's what it is. To be sent on a PCO pump is to give up and go to home hospice. That's all it is. And that's when Fred said, go after him. He cried and said, go after them. Because at that point when he realized that being the good patient who doesn't complain will get you absolutely nowhere.
Even after transferring hospitals and obtaining medical records, there was little that could have prevented Fred's death. He passed away from advanced kidney cancer on June 17, 2009. 1 week later, Regina began painting her mural, which symbolically describes her family's experience with battling cancer under the inefficient bureaucracy of the healthcare and medical systems.
I began these sketches while Fred was in hospice. He gave me a few comments and, changed the things that he thought should be changed. Because he was always very good at that. It's supposed to be a wake-up call painting. It's supposed to be, this bad thing is happening, this tragedy is happening. Look, pay attention, see it, and do something about it. The guy on the computer is this nurse who's on Facebook and drinking a Coke instead of paying attention to what's happening in the room.
Who are those 2 guys right there?
That's the doctor.
But who's the one typing up?
Oh, that's a nurse trying to give me a special medical record behind the doctor's back.
Did you really do that?
Yeah. So over here we have this Roman goddess. She's got a blue cross and a blue shield, and she's standing in money. Why does it say caution slippery slope?
Oh,
did anybody watch the television in the
downpour of healthcare?
Very good, Nathan. Something's going on with healthcare. As the healthcare debate went on, the painting slightly changed. I started adding the quotes because people were like, well, okay, I get it. What am I supposed to do? I get this is about healthcare and something's bad and something's happening, and what am I supposed to do is the constant thing I kept getting back from people. So the quotes were added to the painting because of that. Little Girl America, she came in after the town hall debates began. And I was like, why were they acting this way? Why are people acting this way? Why are people screaming against healthcare reform? And the only thing I could think of is they're acting like abuse victims. Like the classic abuse scenario of, it's all right, I like the way it is, don't change anything, because if you change anything, it's gonna get worse. So I'll make America abused, and I'll make it really subtle.
As a film studies professor, Fred Holliday felt that media was more than a source of entertainment, but rather an outlet for social commentary and debate. It's unarguable that Regina's mural pays homage to his beliefs.
The message, the image, how you put it together, that's what's important, and it's how you get the word out to people. And the painting, the way it's done, is very much within his philosophy of how he thought things should go together.
Regina's message is now being heard worldwide. She has been recognized by Michelle Obama, Senator Harry Reid, the British Medical Journal, and even the Al Jazeera Network. And although her mural in D.C. is completed, she has no plans to stop advocating for reform.
Okay, that's my question for all of you. Is what do we do next? Thank you so much for coming tonight. Thank you so much for being part of Fred's life and my life and spreading the word. And please go out tonight and Facebook and blog and post and tweet, and do not stop, do not give up until we get change in this nation, until people get taken care of, and we all have the right to see our own information. Thank you guys. Thank you.
Thanks, Regina.